Hi everybody. Gary, thank you so much for joining us. Poor Gary, I bumped into him on the plane yesterday and dragged him in. He's at a plastic surgery convention and now he's with us. Thanks for coming, Gary.
Thank you, and don't believe a word of that. This is all planned in advance. No.
I don't believe a word he says. Gary and I were speaking on the plane about the innovations in plastic surgery and how it affects estheticians and massage and everything that goes on in the salon world. Gary, I want to know from you for estheticians who are doing massages, if they have a client who recently had liposuction, is that an issue?
Not really. With liposuction, it's very little difficult to mess anything up. And that's the nice thing about liposuction. People can get back to their activities real quickly. It's things that involve the face and the eyelids. When people have surgery in those areas, you have to be kind of careful.
You mean the laser treatments and dermabrasion? Fill us in.
Yeah, all of that. So getting back to the liposuction, which was your question, massage is one of the best things, and that can be started soon after all the bruising settles down and people don't have any more discomfort. The incisions are very small, so you're not going to disrupt any incision. It's not going to come apart. But certainly with laser resurfacing of the face, any microdermabrasion, you have to be very careful, especially when someone's had surgery on the face, because you can do serious damage, and that's why we tell people to talk to their surgeon before going to any esthetician or spa.
What is the minimum amount of time a client should wait or a patient should wait before he or she goes to get a facial?
It depends exactly what's being done. Now, certainly in the first week after surgery, we have people, we encourage them to use moisturizer, to use sunscreen. They can shampoo after a couple of days, and this is where an esthetician can be, or a salon can be very helpful, because after a facelift, people have a lot of, a little blood in their hair, and it can help a lot in helping the scars early on, after the drains come out. But as far as anything that might involve a peel, I usually tell people to wait about 3 or 4 weeks.
For patients who have had facelifts, how about getting haircut, going to the shampoo bowl?
Shampoo is great after about 48 hours. It's coloring that you'd really want to wait about 4 to 6 weeks. You ladies would know better than I would as far as the stress on a hair, on the circulation to hair follicles. And hair can really take a beating, especially when someone's had a brow lift or the incisions that go into the hairline. So that's something you want to wait for coloring about 6 weeks.
Many of us cannot wait 6 weeks for color, Gary. What do you suggest for us?
Well, in the first 6 weeks, you're going to be loving your new face so much that you're not going to be interested in your hair.
Want to bet? you know, you're here in the salon world. We do care about our hair. How about a lot of salons carry lines, carry their own skincare lines. Are there any special ingredients that should be in these lines, special ingredients that we should be looking out for and be looking out for?
Nothing that's really detrimental. I mean, there's things that that help the skin a lot, things with antioxidant properties, vitamin C, and there's so many. Again, I'm talking to the pros here as far as things that are helpful. But obviously, after a facelift, there's nothing that's too irritating on the skin. So anything that may have any acid in it, you want to hold off for about a month or so before using that on a facelift patient.
Okay, now for hairdressers and salon owners as patients of yours. When I spoke with Gary earlier, he said very few people are actually having facelifts, that they're doing a lot of the liquids and the injections, which Gary and I have been talking. I may be visiting him in a little bit. Tell us more about that, the innovations and how wonderful they are.
Well, the fillers in Botox are clearly the most important things we do, because that keeps people coming back. So someone may have a facelift when they're in their 50s or 60s, but you can start these fillers very young. So Botox has been around for about 10 years, and now it has a competitor called Dysport. It lasts about 6 months, and it's fantastic for dealing with the wrinkles of the upper part of the face. The lower part of the face, we use fillers, and the most common one would be something with hyaluronic acid in it. And the common ones would be Restylane and Juvederm. And they also last about 6 months.
I appreciate you not using all the big words. That's great for us. So I know there were several people in the audience that wanted to ask Gary some questions. Excuse me, Dr. Smotrich. Anybody have anything in particular? A question from the audience is about the lines in the neck. Gary, tell us what we can do for those.
You could do a light peel on the neck. There are some people that do laser resurfacing on the neck, but you have to be very careful. The skin is thin, And if you have any scarring, it can be disastrous in the neck area. But certainly we peel down to the cleavage area with good results. So the fine lines of the neck, you have to be very careful. There are obviously people who don't do surgery on the neck because they're much more cavalier about it, but you can have disastrous results. So scarring is the thing that we fear.
The question is, do you prefer chemical or laser for the neck area?
I usually use chemicals. The laser, again, some of the lasers, they're very low intensity, so they don't do a whole lot, but it's still the gold standard. When people have a lot of wrinkles, deep laser resurfacing is still the best. There's a lot of recovery with that.
This is for the patient who has had breast augmentation. She wants to go to the spa and have a massage.
Well, chances are someone's already done the massage in the home setting, but you would. It's uncomfortable. Things are uncomfortable for a few weeks, but after that, it's safe. Right. If it's safe enough for a mammogram, it's safe enough for a massage.
Yeah, we don't like those mammograms. Those things hurt. Hereditary dark circles. Gary?
Well, every Sunday in the New York Times, I see these ads for a lot of products, and you'd know better than I would how they work. As far as surgery, nothing works, and generally the lasers that we have don't work well either. It's something like intense pulse light can help with brown spots, but this is a collection of blood, and it's just pigmentation that's been built up over the years. And a lot of times we tell people, cover up makeup is the best thing. Now, I have no idea, again, how the products work, but you probably have a lot on the floor here.
And what about the brown spots?
The brown spots do respond well to lasers, and there's something simple called IPL, or intense pulse light. So we have a lot of ways to treat that.
Gary is the president of the New Jersey. I'm going to have Gary tell his title.
We're jumping the gun by 3 weeks, but incoming president of the New Jersey Society of Plastic Surgeons, representing about 150 plastic surgeons in New Jersey.
And you also have your own Lawrenceville Plastic Surgery outside of Princeton, New Jersey.
Right. In central New Jersey. Central New Jersey,
and there we are. That's that Jersey thing again. We just can't get away from it. Which brings me to something very special. We have been so dissed on a regular basis with Jerseylicious, the Jersey Shore, the Real Housewives, and that's my town. I'm really irked by that. As a plastic surgeon, what would you say we can do to make ourselves look a little higher end?
Well, I wouldn't change a thing because Jersey Shore premiered since last summer, and in New Jersey you have to look good for the beach. So I think it's the best thing for our practices.
Have you had more clients or patients as a result?
Absolutely. Breast augmentation business is way up.
How about these clients who are tanorexics? Are you helping them one way or the other?
Well, we don't discourage tanning only to the extent that it can lead to skin cancer. Now, the interesting thing is that the federal government was proposing a tax on cosmetic surgery, and they changed it to a tax on tanning. So our gain is the tanning salon's loss. But let's face it, you walk around in the summer and you're pale, you look like you're ill. So there's no way of really telling people not to tan, but you have to be careful like anything else.
You okay with spray tanning?
A little bit out of my league, but I don't think it causes any harm.
Because I'm a paleorexic.